My first
Okay.
question has to do with the COVID-19 vaccine. Today, the CDC said it's monitoring pregnant women that are getting vaccinated across the nation. There are thousands of women who have been vaccinated currently, and so far they're saying there are no negative signs or side effects on the pregnant woman from these vaccines. So my first question to you has to be, how are you looking at this, and do you recommend pregnant women getting the vaccination?
Right. Absolutely. What we've had a lot of data now. I think over 30,000 pregnant women have been vaccinated to date, and we're finding that there's no increased risk of any problems. Compared with women who didn't have the vaccine when they were pregnant. So I would definitely encourage it because COVID-19, if a pregnant woman catches it, is much worse. It's actually considered high risk. And all of us have heard stories, unfortunately, where, pregnant mothers have been in the intensive care unit and either the baby didn't make it or the mom didn't make it. So if you are pregnant, I definitely would encourage that you get the vaccine, because if you catch COVID-19, you're at much higher risk. And then there's 2 lives in danger instead of 1.
Right. When you're looking at the pregnant women, Dr. Parikh, do you recommend women that are very close to delivering of getting COVID-19 vaccine? Is it more for people that are in earlier stages of their pregnancy?
Yeah, I mean, we actually have data of women getting it throughout their pregnancy and doing very well, especially those who are in high-risk groups like healthcare workers, or if you have other medical problems that put you at higher risk for COVID-19, then it's even more reason that you should get it. Also, there were women who were in the clinical trials that became pregnant, even after their first dose or their second dose, and they're all doing well now. So it looks like it is very safe, even in all trimesters of pregnancy.
Right, and just talking about women, a recent research, Dr. Parikh, has said that perhaps women are getting more side effects of the COVID-19 vaccine in comparison to men. I'd like to know why that is happening. There are some statistics about it too.
Right. So in terms of side effects, all of the side effects from these vaccines are very short-lived, meaning none of them are serious, none of them are severe, none are permanent, and many are expected from many vaccines. So for example, you might get fever, chills, achiness. Again, you're not getting sick, but basically it's your immune system reacting to the vaccine. And in general, women's immune systems are more reactogenic. So for example, like women are more prone to allergies than to men. Women are more prone to autoimmune diseases than men. But that doesn't mean that the vaccine is unsafe for women. It just means that their immune systems may react a little more strongly. But again, these are all expected side effects, and none are permanent or dangerous.
Right, and when you're looking at vaccine, I have to ask you, how are you looking at the Johnson & Johnson distribution and the administration of the vaccine? People are still concerned about the fact that the efficacy is low in comparison to Pfizer and Moderna. What do you have to say to that?
Right, I wouldn't really compare the efficacy at all, actually, because Moderna and Pfizer, that efficacy was studied when there were no variants around. So if we were to study all 3 of them at the same time in the same trial, we might find that the efficacy may actually be very similar, So you can't really say that one is more effective than the other. The most important thing is that Johnson & Johnson prevents death completely by 100%, and also prevents hospitalization by 100%, which is huge, because this way, if you get sick, it will save your life. It will keep you out of the hospital, and those are the things that are most important. So I would still get it, because even in areas of the world like South Africa, it still prevented death and it still prevented hospitalization. So I think it's a very efficacious shot. It's only one shot too, which is a big benefit. You get immune much faster than with the other 2 vaccines. So we are encouraging people to take whichever is offered to them first.
And Johnson & Johnson has said that they're also working and studying on a booster shot that could be given after the initial vaccine dose. How are you looking at that? How important do you think that is going to be?
Yeah, so not just Johnson & Johnson, but both Moderna and Pfizer are also looking at booster shots because, right now it looks like all the vaccines are doing pretty well with the variants, but we don't know if that may change. So we don't know if that extra booster is needed. 2, we also don't know how long the immunity lasts. We're projecting a year, but we're hoping even more so. So we'll see. That's why we do the studies, to see if the booster is needed and what that will look like.
Right. Let's now talk about the variants, Dr. Parikh. I have a couple of questions regarding it. The New York variant has been considered highly contagious, and the UK variant is considered more deadly. Just in New York City right now, 51% of COVID-19 cases are due to the variants. Can you explain to me why this variant is spreading so quickly and so fast? And how worried are you when you're looking at the downward trajectory of cases, but these variants are coming in now?
Right. So these variants are not unexpected. So these viruses mutate anyway every 2 weeks. The problem is when there's too many mutations where it makes these variants, or makes a virus more contagious or more deadly, or God forbid, makes it so that the vaccines are less efficacious. And variants come out more quickly when the virus is allowed to replicate. So it can't really mutate if the virus has nowhere to go. And this is why it's still so important to keep masking and distancing and washing your hands and following those guidelines, because that's what's going to prevent these variants from occurring. Also, as more people get vaccinated, that will also prevent new variants from emerging, because then it's less likely that people are passing the virus on from person to person. So all of these measures are important. I think, as these cases go down, the more important thing is looking at those vaccine numbers going up, because if the vaccinations continue to be more than confirmed cases, then we have a good chance against these variants, because then it'll be less likely that new variants will emerge, because hopefully the spread and the transmission will be less.
Right. And looking at this decline of cases as well as these variants coming in, CDC Director Dr. Walensky said that the months of March and April are going to be very pivotal in understanding what happens in the nation and if there's a fourth surge or not. How are you looking at it?
Yeah, I agree. The CDC also recently released some new guidelines too, in how vaccinated people can, alter their behavior a little bit, especially if they're around other unvaccinated people. So I think it will be crucial, because by then more people will be vaccinated. In springtime, people have a tendency to gather more, engage in social activities more. So hopefully, things don't surge, we continue to do better, but we'll see where it goes. Right now, luckily, things are looking good, but hopefully they continue going down and not up.
Right, and these guidelines, Dr. Parikh, it says that, people that are vaccinated can meet with people that are also vaccinated, and that is safe for them. It's saying that they can have small gatherings with both vaccinated and unvaccinated people. It's recommending that you can see others, but it's not recommending to travel. My question to you is, what is your personal recommendation as a doctor for vaccinated people?
Yeah, so, I would follow those guidelines where they're saying, keep the mask on unless you're in a very small group where everybody has had their vaccine, because that is the safest. So even if 9 out of 10 people have been vaccinated, it's still a good idea to protect that one person and even protect the group as a whole, to keep masking, washing your hands. And then, travel always increases the risk of, the virus spreading, especially because you have no control who else is with you in, let's say, an airplane or wherever else you may be traveling to. So even if you're vaccinated, you may be surrounded by those who aren't, and vice versa, And again, these vaccines aren't meant to be 100% cure or guarantee. They're just meant to save your life if you do get sick. So you can still get sick. The whole point is you won't die, or you won't end up in the hospital. So I would still be cautious until we have more people vaccinated. I think right now it's only about 10% of the entire US population. Once we can get to that 70, 80%, of course, then the restrictions won't be so strict anymore.
So would you say for the rest of the year, we have to stay vigilant, we have to wear our mask and practice social distancing?
Yeah, at least until we can get closer to 70 to 80% of the country vaccinated, I think we have to continue to be careful. The good news is, I know the current administration has announced that they'll have doses for everybody in America, I think by the end of May or June. So that's excellent. Hopefully that means it'll be before even the end of the year that we can loosen some of these restrictions. So, but again, that depends on everybody going and getting their vaccine and the actual logistics and the rollout of getting people vaccinated.
And meanwhile, there are states across the nation right now that are easing restrictions. Texas, as of today, has lifted all mask mandate in public. They have also opened their businesses to full capacity. How are you looking at it as a medical professional? Is it a wise decision to do it right now?
Right. I don't think it's a wise decision to do it right now. We're very, very close to these restrictions loosening in general. The worst thing would be is that, right before we achieve that, things get worse because we kind of jumped the gun too soon. I understand the need for businesses to get back together. The economy is suffering. But I think it's a bad idea to restore businesses and remove masks in public, especially when, again, less than 10% of their state has been vaccinated. They're not near the numbers where the whole public can let their guard down. So I hope people will still mask and, still be cautious. I heard a good analogy. It's kind of like, giving up in the third quarter of a game. Even if you're winning, you still have that last quarter of the game to play, and you could lose still. So I think it's unwise to jump the gun too soon.
Right, and many states are, looking at Texas, and they are thinking about reopening their economy, reopening many things. Let's say a lot of these states end up loosening restrictions in the next month or so. What is the worst case scenario according to you?
Well, worst case scenario is that cases start increasing again, and then new variants emerge. And in many of these states, a lot of the hospitals, healthcare workers are already beyond the point of burnout, and so it's kind of unfair as well to put that much undue stress on people that have been, taking care of sick people for almost a year now, and put that much stress on resources that are already kind of taxed at this point. So the worst case scenario is, yes, that, these healthcare workers, the hospitals, again, just are at a breaking point and gets worse. And then we have more cases, we have new variants. And, if people are traveling, those outbreaks can occur in any state, even other states that are being more careful.
Right. And again, traveling is a huge thing. You could be vaccinated and fine, and then somebody comes from a different state that has all these restrictions open and really will impact you. Another issue that's up for debate, and it's been something that President Biden is also stressing on, is reopening of schools. Today we heard a huge news from LA that they are opening up, and they're one of the largest school systems in the country. And my question to you is it safe, according to you, to open up these schools and let these middle schoolers and high schoolers go back into those settings without these teachers fully getting vaccinated? What is going to happen? Why are they suggesting that it is safe to open these schools up right now?
Right. So schools are, in general, luckily, and this is excluding colleges, but schools like high schools, elementary schools, luckily have had very few cases or outbreaks, since this pandemic started. And unfortunately, I think children in general have lost a lot from in-person learning because it's very important in development at all ages, and it's very crucial for learning. So I think getting kids back to school safely is actually a good idea because unfortunately, I think a lot of children are suffering the consequences of, adults' mistakes. But that being said, I think absolutely all the teachers and anyone who interacts with children in these environments should be vaccinated because, they could spread the illness to children or vice versa. And we don't have a vaccine ready yet for school-age children. So absolutely, I'm for reopening schools, but as long as all of the adults are also vaccinated and they're still taking those precautions. So the masks have to continue in schools, the distancing, and the other hygiene and sanitation measures.
Right. When you're looking at the reopenings, do you see most schools reopen by the end of this year if everything is vaccinated? And my follow-up question to you is, you just mentioned children getting vaccinated. What insight could you provide us on that?
Yeah, I think by the end of this year, I do see most schools reopening. And the good news is, speaking of children and vaccines, they're already studying age 12 and up. And I don't know if you heard, Alaska is starting to vaccinate 16 and up as of today because they're so far ahead of their vaccination schedule. So, I think at least that age group, we will definitely 12 and up will start vaccinating by summer. And then after that will be probably the younger children because we need to study the vaccine in each age group. So I do see that hopefully by the end of 2021, hopefully we'll have most schools operating kind of normally because hopefully by then all the adults will be vaccinated, majority of the children will be vaccinated. So I'm optimistic about that.
Right. I just have two more questions left here for you, Dr. Parikh. My first question to you is, right now the Biden administration is trying to do its best to ramp up vaccination, but there are still a lot of uncertainties in states. There are many people who should be vaccinated or not vaccinated. What do you think they need to do in addition to whatever they're doing right now?
Yeah, I think just access to these vaccine sites needs to be easier for people, and signing up for vaccine appointments needs to also be easier, meaning, there needs to be sites that are 24/7, especially for people who work long hours, weekend vaccinations available. And then, the whole signing up process is not easy, because even though it's online, sometimes it's hard to find out if there's an opening last minute. Especially for elderly people who might not be good at using, computers or technology. So I think we need to make it as easy as possible for people. So even if that includes calling a number or even just showing up, there should be a way to accommodate people, especially for those extra doses that I've heard are being discarded. That should not be happening. There should be some type of walk-in policy at all of these sites just to make it as easy as possible for people to get vaccinated.
Right. And my final question to you is actually a little different. It has to deal with the world. We're hearing that, a lot of first world countries, including the United States, are vaccinating its people. The process is going on. However, there are some very poor countries that haven't even started the vaccination process. How important it is for each country in this world to be vaccinated, according to you? And what impact would it have if poorer nations are not vaccinated?
Yeah, actually, that's a very good point. It's extremely important because, one, just from like a social and health equity standpoint, I think it's unethical if only the richest countries in the world have access to a vaccine and the poorer countries do not, because that's just inhumane, and human rights issues then come into play. But even if you don't look at it that way, it's actually in everybody's best interest for everyone to have access to the vaccine because, the UN Foundation says it well, an outbreak anywhere is an outbreak everywhere, especially in 2021. So an outbreak in a country that, you may not know anyone, right? That same virus can end up in your own backyard the next day. I mean, look at this pandemic, right? It started across the world, and now it's completely changed our lives. It's taken 500,000 Americans. So it's actually in our best interest too to ensure that everyone globally has access to a vaccine.
Right before letting you go, I would love for you to give a message out to anti-vaxxers. We're hearing millions of people are still against getting this vaccine. What do you say to them?
Right. I mean, I say the same thing always. You really should be more afraid of the actual virus than the vaccine itself. The actual virus has far more side effects, the worst being death. And even those who survive, I think 75 to 80%, even a year later, are now living with some long-term complication from their COVID-19. So whereas the vaccine, we know it's safe, we know it's efficacious, the side effects are short-lived. I myself have gotten it. So, I wouldn't inject myself with something that I thought was unsafe in any way. So that's the biggest message. The virus has far more side effects. Again, more than 500,000 Americans lost, millions lost worldwide. It's completely changed our lives in just 1 year. So to me, it's a no-brainer.